So, have you dealt with erectile dysfunction, ED? That's a big deal on a lot of ads. A lot of big pharma saying, here, just take our blue pill, just take our pharmacy, and that's going to fix it. Not so fast. It's a lot more complicated than that. And in fact, this may be a warning shot over the bow that you've got a very serious disease going on. Take a look.
So for the short topic for today, Dr. Brewer sent me an interesting conference video from Dr. Vessels from the University of Washington talking about mechanisms of diabetes and erectile dysfunction. And for a lot of people, it's news that diabetes might be related to erectile dysfunction. To a lot of people, that is not news. They know that there is a link over there. What a lot of people doesn't know is that this goes far beyond that just high blood glucose level, far beyond that just nerve damage. There's a lot of research that's talking about how other metabolic processes are impacting the health of the endothelium within those areas and producing erectile dysfunction. So on this talk, Dr. Vessels presented a lot of evidence on how there's damage to the endothelium, to the cell wall. There is low oxygen flow, a lot of other markers of inflammation related, damaging the arterial wall, creating oxidative stress, which is damaging all of those structures, not just nerves, it's the nerves and the vessels. Decreasing the amount of nitric oxide, and if you remember the mechanisms of erection, you have to vasodilate, you have to expand those arteries so there's blood flow going there, and nitric oxide is critical for that process. So diabetes and insulin resistance is impacting those molecular pathways, cellular pathways as well. This RHO kinase, which is also called ROCK, those are molecular mechanisms that if they get activated, they increase muscular contraction. The small muscles on the area are getting more contracted, or they're not getting relaxed enough, and you need to get those vessels relaxed in order to give direction. So they're even researching RHO kinase inhibitors as treatment for erectile dysfunction. And there's another molecule that is produced in the liver that is called ceruloplasmin that also has been related, that the increase on ceruloplasmin might be related to erectile dysfunction issues. What is this all this stuff important? All this stuff is important because this just gives more evidence that controlling diabetes, targeting insulin resistance, is going to provide a lot of benefits even for ED. Of course, medications help for ED. Those can increase the amount of nitric oxide, increase relaxation of the vessels. But if you have an uncontrolled diabetes issue, if you have a severe insulin resistance issue, that might not be enough. And we're talking about the root causes of cardiovascular disease, and ED is a reflection of that. Any comments?
Yes, as you know, we've discussed this. I'm trying to figure out how to tell this story appropriately. I've never really covered ED. I didn't want to go there, didn't even think it was important for our population. I mean, it's like, how dumb can you get? What's more important than sex? And it's such an issue in terms of cardiovascular patients, diabetes patients. And it was a few months ago, one of our patients in his mid-60s rediscovered sex. He said, gosh, I think I died and went to heaven. And we've been having conversations. I think he and mostly his partner are nervous about, just how much to share and what to share. But the point is, there's a major impact in terms of life, enjoyment of life, that revolves around sex, which is just significantly impacted by the conditions we deal with. So we're struggling right now in terms of how to tell the stories, but the clinical information does not change. And so we're starting to get a little bit more information out there about this. Comments, questions would be welcome.
Yeah, and Dr. Brewer knows this. We haven't explored that so often. I do use that information on my private practice in Mexico, but I'm also a relationships and sexual health coach. So I do have a couple of patients in Mexico that come for advice on this area. And when talking about sex, of course, one of the first things that I talk about is safety is really important. There's a lot of venereal diseases out there that you have to be careful of, but it's a critical piece. And one thing that men with diabetes has, first they say, okay, my life might be over because I might have kidney damage, eye damage, and all of that. But sometimes are even accepting the fact that their sex life might be over as well.
When it's often not. Again, one of the biggest eye-openers for me in terms of running this channel, how prevalent that is, that concept that we started covering. We've got a series over the past 3 months. We started covering items on ED and men's health. And sure enough, after covering that first short topic on it, a dozen men so far have started saying, hey, can we talk about that? So it's a topic. It's just not folks in our group, a lot of boomers in our group, and boomers as a demographic are just not that comfortable talking about sex yet.
Yeah, and I think we showed statistics last week or 2 weeks ago, more than 50% of folks about around 40, 50s are dealing with any level or grade of erectile dysfunction.
Looking to improve your health and add decades to your life? Join me and the PrevMed team December 1st and 2nd in Tampa, St. Pete for the Heart and Stroke Prevention event. This is an event, not just a conference. You'll not only learn how to prevent heart attack and stroke using my battle-tested methods, you'll also access accurate, predictive testing that the majority of physicians never use because they don't know how. All you need to do is click the link below this video or simply go to PrevMedHealthTampa.com to sign up. Hope to hear from you. Thanks.